Hello everyone, my name is Dr. Shankar Prasad. I'm a physician and I would like to talk to you regarding obesity. Obesity is a very common concern nowadays in all countries across the globe. Earlier in country like ours, the problems used to be more of malnutrition, but with increasing opportunities, increasing industrialization, food revolution, the green revolution and everything, the problems of obesity is becoming more and more common starting from a very young age. First of all, what is obesity? Obesity means when we take a ratio between the weight of the person and the height of the person. We call this as a BMI, basal metabolic index. So the BMI of the person, when it is more than 30, then that condition is referred to as obesity. Or in other common words, it is basically particular degree of being overweight that is actually called as obesity. When this obesity, when the BMI crosses 40, then it is actually called as being morbid obesity. So what exactly happens in obesity? Normally, whatever calories we take, whatever food we take, the body ultimately converts that into calories, energy levels. So this energy is spent in various ways. One is basal metabolism. That is for our own existence. For the body to exist, it would spend some calories. Second is in physical activities. In different physical activities, it would spend those calories. In intellectual activities and for metabolism of all tissues. So whenever there is an excessive amount of calories flowing into the body compared to calories being spent, typically that happens when we are not indulging in much of physical activity. Most of the time we are sedentary, we are not walking much, we are not playing much, we are not exercising much. So that's typically, but we continue to consume 3 times a day meal, a heavy meal, rich in calories, etc. So that's when typically the body starts converting all the extra calories into adipose tissue, into triglycerides, which form adipose tissue or fat. So this fat typically, not ideally, goes into places which we do not use much, which happens to be our waist region. So obesity predominantly starts by deposition of fat in the abdominal region or the tummy region. So this obesity is basically of 2 types. One, they say the apple type, second is the pear type. So, or the android type or the gynecoid type. Many people find fat getting deposited more in the buttocks and thighs. Whereas for some people, their legs are very thin, but their abdomen is very huge. So this second variety, wherein the abdomen becomes very huge, but the legs are very thin, is associated with the more dangerous complications like diabetes, heart diseases, cancers, paralytic strokes, etc. So what exactly are the problems associated with obesity? When the entire nutrition starts going into the adipose tissue or the fat tissue, the nutrition of the other tissue starts getting depleted. So the bones start becoming very weak. They start developing osteoporosis. Because of the excess fat, they start developing blockages in different arteries. So that they start developing blockage in the heart vessels. They start developing blockages in the blood vessels of the brain. They can get a paralytic stroke. They start snoring a lot. Fat starts developing in the chin region. So they're not able to breathe properly. They're not able to expel the carbon dioxide properly. They're snoring a lot in the evenings. And they have a host of other metabolic problems like uric acid becomes very high. They have more predilection for cancers, etc., etc. So obesity is very clearly known to reduce the lifespan of a person if the issue is not addressed. How do you diagnose obesity? It's very simple. Actually, all that we need is just to know the height in centimeters and the weight in kg and the waistline. 3 things we can clearly point out whether the person is obese or not and what kind of obesity is. Management of obesity. The fundamental way to manage obesity is basically through calorie management. You need to know exactly how many calories you are eating and how many calories you are spending, and you need to match this. So the typical principle is trying to cut down calories by taking high fiber foods. Typical high fiber foods include grains like barley, rye, different kinds of millets, the kodo millets and the foxtail millets, etc., etc. And then the jawar, sorghum, ragi, this kind of grains as staple diet, not as an occasional diet, but consuming this high insoluble fiber diets as the main food, taking a lot of green leafy vegetables, taking a lot of soluble fiber containing vegetables, and cutting down on high calorie foods like fats, trying to cut down on highly refined carbohydrates, cool drinks, pastries, cakes, etc., etc., etc. So these are all unrefined carbohydrates. At the same time, the second emphasis should be on increasing our physical activity. So increasing exercise, doing regular physical activity, depending on the kind of BMI, maybe doing it gradually, would help in reducing the increasing the calorie expenditure. So by balancing these two aspects, obesity can be managed. If these are not happening, then yes, there are a few medicines that can be tried, which are not very successful in all times and in all people. And nowadays, there is an explosion of bariatric surgeries. Whenever there is morbid obesity and somebody who's not able to lose their weight with diet and other managements, they have surgeries in which the size of the stomach is cut down to minimum. So that's called as bariatric surgery. All these are different ways in which somebody can understand and manage obesity.